You're listening to an African Elements top news story for June 10, 2025. Please visit our website at africanelements.org for more daily news. Chad-Sudan Refugee Crisis, A Humanitarian Wake-Up, by Darius Spearman, African Elements. The shared border between Chad and Sudan is currently gripped by an escalating humanitarian situation, one that has plunged countless lives into peril. The massive flow of people seeking safety from ongoing conflict in Sudan has pushed Chad's already strained resources to their absolute limit. Therefore, the international community must act with urgency and compassion to prevent further catastrophe. Chad, a nation already grappling with its own internal challenges, faces an overwhelming surge of refugees. Furthermore, the country now shoulders the immense burden of hosting over 1 million refugees, with more than 800,000 of them arriving from Sudan since the conflict began. The challenges are not simply about numbers. It is a profound human crisis demanding a robust and sustained response. Chad's humanitarian landscape is complex, extending beyond the immediate impact of the Sudanese refugee influx. A staggering 40% of the nation's population requires humanitarian assistance, a figure that highlights widespread hardship across the country. This widespread need stems from a multitude of factors, including persistent climate shocks, ongoing internal conflicts, and recurring health emergencies. The arrival of tens of thousands of new refugees further compounds these existing vulnerabilities. In the last 30 days alone, Chad has welcomed over 47,000 Sudanese refugees. This influx brings the total number of Sudanese refugees to a level comparable to the beginning of the conflict in 2023. Chad, a nation predominantly inhabited by people of African descent, finds itself on the front lines, bearing the brunt of a regional crisis with global implications. Therefore, immediate and substantial support becomes even more critical to alleviate the suffering of both refugees and host communities. The current displacement crisis stems from a brutal conflict that erupted in Sudan on April 15, 2023. This devastating clash involves the Sudanese Armed Forces, SAF, and the Paramilitary Rapid Support Forces, RSF. This violence has torn the fabric of Sudanese society, forcing millions from their homes and triggering waves of displacement both within Sudan and into neighboring countries. More than 12.5 million people have been displaced internally, while an additional 3.4 million have fled to other nations. The situation is further complicated by severe weather conditions, including floods, which have exacerbated the humanitarian catastrophe. The humanitarian needs are immense, with violence and shortages of basic necessities creating a desperate situation for those left behind and for those attempting to find refuge. Thus, the echoes of historical instability in the region resonate deeply, reminding us that these crises are not isolated incidents, but rather intensified manifestations of long-standing challenges. The humanitarian response in Chad is severely hampered by a significant lack of funding. Shockingly, the refugee response plan is only 4.7% funded, a stark indicator of the urgent financial support required. To adequately meet the needs of refugees, approximately $806 million is required. However, the overall humanitarian response in Chad demands even greater resources, with a total need of approximately $1.454 billion. This critical funding gap has direct and devastating consequences. It means that vital aid, including food assistance, healthcare, and shelter, cannot reach all those in need. Furthermore, organizations like the Norwegian Refugee Council, NRC, which strive to provide humanitarian assistance, are constrained by these funding limitations, restricting the scope and reach of their life-saving operations. When humanitarian responses are so severely underfunded, the ability to provide adequate aid is drastically reduced, leading to increased suffering and mortality rates among the most vulnerable populations, disproportionately affecting Black populations already struggling due to historical inequities. A particularly heart-wrenching aspect of Chad's humanitarian crisis is the widespread issue of malnutrition, especially among children. Over 100,000 children in eastern Chad alone suffer from severe acute malnutrition, SAM. This condition, marked by a severe deficiency in nutrients due to inadequate food intake or disease, dramatically increases mortality rates. The challenges are exacerbated by the fact that many refugees must travel long distances to access any form of care. Beyond the refugee population, Chad faces systemic malnutrition issues, with a staggering 1.8 million children impacted across the country. The overwhelmed healthcare facilities along the border, coupled with frequent shortages of essential medicines and a complete lack of specialized mental or reproductive health services, further deepen this crisis. Therefore, addressing the child malnutrition crisis requires a multifaceted approach, encompassing food security, accessible healthcare, and long-term development efforts. The conflict and subsequent displacement disproportionately affect women and children, who comprise the majority of Sudanese refugees in Chad. These vulnerable groups face intensified risks during displacement, including exploitation, increased health needs, and limited access to essential services. The perils of exploitation and sexual violence are particularly high for women and children amidst the chaos of forced migration, necessitating specialized protection measures and medical care tailored to their unique circumstances. Moreover, the existing healthcare facilities are ill-equipped to handle the complex health challenges faced by these populations. There is a pressing need for specialized services in mental and reproductive health, which are crucial components of holistic care for survivors of conflict and displacement. Furthermore, the long distances refugees must travel to access even basic care exacerbate their suffering and increase the risk of severe health outcomes. Therefore, focused efforts to protect and support women and children are paramount for alleviating the deepest forms of human suffering in this crisis. The humanitarian crisis at the Chad-Sudan border often falls outside the spotlight of global attention. This neglect is a common plight for many African nations experiencing crises. It underlines a broader issue of global power dynamics and funding inequities, where other conflicts and humanitarian emergencies in different regions receive more robust resources and media coverage. This differential treatment has devastating consequences, deepening humanitarian challenges in African regions that are already bearing the brunt of protracted instability and systemic disadvantages. Furthermore, the lack of sufficient funding for crucial response components, such as food assistance, healthcare, and shelter, directly impacts the survival and well-being of refugees and host communities. When these vital components are underfunded, aid delivery is drastically reduced, leaving countless individuals without essential services. This neglect contributes to increased mortality rates and exacerbates the humanitarian crisis, turning a dire situation into a catastrophic one. The plight of Sudanese refugees in Chad is a stark reminder that humanitarian and development efforts must be rooted in justice and equity, ensuring that all lives, regardless of geography or geopolitical significance, are valued and protected with the same urgency and commitment. Copyright African Elements.